Hey guys, what's going on? It's Dr. Geiger with Chesterfield Plastic and Reconstructive Surgery. Welcome back. We're going to go over today what it's like at your second post-operative visit after a tissue expander or an implant-based breast reconstruction. So congratulations, you're still getting better each day as time's going on. Hopefully at this point in time, you may totally be off all pain meds. Maybe a little bit you still need at nighttime to help you get to sleep, or a little muscle relaxing here and there. But for the most part, hopefully you should be weaning off those pain meds using Motrin, Advil, Ibuprofen, Aleve, something like that to help out, or maybe just a little bit of Tylenol or whatnot. So we'll go over that when you're here. If you need something a little bit more, we'll go ahead and get you another little refill if necessary. So your biggest question at this visit undoubtedly is going to be, are you going to get this last drain out? So hopefully we can. Bring in your drain sheet. We're going to go over all that. We're going to make sure. Now again, I like things to be pretty spot dry before we're going to remove those drains. We need things to heal and stick down. Way easier to keep that drain in a little bit longer to make sure it's appropriate to come out than it is to pull it out too early. Your body builds up with fluid there, and then we've got to do ultrasounds and needles and aspirations, and we got to wrap you up and keep things compressed. It's not fun at all. So if it's appropriate, absolutely, we're going to get that last drain out. So if you had your drain out at your first visit, or one of those drains, you'll know it doesn't really hurt. Okay, it feels a little weird, but it's not really uncomfortable. So if we get that last drain out at this visit, this time we're just going to put a little gauze and some tape over that little drain hole. That drain hole is going to heal and close down in about 2 days or so, or seal up in a day or two. I don't put antibiotic ointment over that area because if a little bit of fluid still needs to kind of leak out, I want it to leak out or get sucked up into some gauze. I don't want it to hit a wall of ointment and get trapped in on the inside, So we'll put gauze and some tape on there. The next day you can change that, just put a Band-Aid on there. You can shower the next day on there is perfectly fine. Just don't soak in a bathtub on there because again, that's still an entrance route into the breast. And just put a Band-Aid on for the next day or two without antibiotic ointment, and that'll heal up no problem on there. If we get those, if you have tissue expanders in, now is also the time when we're usually going to fill up that tissue expander for the first time. So yay, all right, we're going to keep progressing things along. Don't worry about it. It's not going to be uncomfortable for a couple of reasons. So when we did the mastectomy on there, all the normal blood flow to the skin was going through the breast. Well, all the nerves to the skin were going to the breast too. So that you probably noticed by now that breast skin's kind of numb. So when we fill up that tissue expander, usually you don't really feel that little needle that goes in. So here's how that process goes. We have another video on our website. Please take a look at in the breast reconstruction episode. You can watch us do a tissue expander fill on a patient again, and it's not very uncomfortable at all. So here is a tissue expander, an example of one. It has, there's a large area that we can poke that with the small little butterfly needle. Same thing if you're giving blood. It's a little metal port that's on the inside of that. So this is just a medical water balloon, all right? We're gonna find where that perfect sweet spot is. I have this special little device, and I don't know if you can see the this little blue guy right here. As I move that along, it kind of goes side to side and tells me, oh, that's the middle. Same thing, if we go up and down on it, and it's going to point and tell me exactly where the middle of that expander device is. So we're going to find that on the breast, mark that area. We're going to double clean that area, and then me and one of my medical assistants, we're going to go ahead and fill this up. So we put a small little needle in there, and we start filling up with the same fluid that would go in your IV if you had dehydration. It's just normal saline out of a bag, same thing, out of an IV bag on there. So we're going to fill that up to as much as safe and as much as tolerable on there. So I'm going to be watching your skin throughout this whole process, checking your incision, make sure things aren't getting a little too tight. I can't tell what you're feeling on the inside, so it's normal to feel a little bit of stretch. Again, we're trying to stretch some stuff out. So you let me know if anything starts getting a little uncomfortable, and we stop. We can always pull back a little bit. We can add a little bit more. Again, I'm going to go as much as we can to safely get things filled out. I want to take care of all the space that's between this expander and your skin, so the more that that's filled out, the quicker we get that last drain out on there by doing it in a safe manner. So we'll work through that. Don't get too worked up over doing it. Fairly simple, pretty easy process. We'll have you back once a week or so, or once every other week, and we'll keep filling until we get to that final where we need to go. When is that? Well, it depends on a couple of things. Depends on how much we're able to get in there initially with the reconstruction. Depends on how big we want to go on there. It depends on how you tolerate each fill. As we get fuller and fuller, sometimes you put a little bit less in. The body needs a little bit more time to recover in between each. If you were directly to an implant and you don't have a tissue expander, you may or may not be getting your drains out at this visit. Again, since we're not filling anything out, I got to make sure it's spot dry before we're going to pull those drains out. So if we do get those drains out, we do get you filled up, all that sort of stuff. Give me 1 more week of the same arm range of motion restrictions. So again, bringing your arms up to about 90 degrees. Anything in front of you is fine. Down here you can do all this stuff. No big deal. You can eat. You can brush your teeth. You can wash your hair like this. You've got used to doing a lot of this stuff already. You're going to have less discomfort, so you're going to be wanting to move a little bit more. And that's okay. Things I don't want you doing still, especially if those drains are out, again, is reaching really high or reaching way far back. 1 more time, you've got an implant or expander in here, there's something holding that in place, and then your breast skin is laying on top of this. And we want those 2 surfaces sticking together, okay? They're having these little attachments. Right now they're attaching pretty good. If you start really stretching that out and the skin starts sliding across there, we don't want to break those attachments just yet. So if your drain are all the way out, or regardless, just give me 1 more week of the same arm range of motion restrictions, and then we'll have you start doing some wall walks and stretch it out. All right, a wall walk is, it's kind of hard to lift your arm up when you're sore, and this hand doesn't really help kind of lift it up, but you can use the wall to help you out. So that would be going up against the wall. You can put your hand up there, and you can sort of walk your fingers up a little bit. That gets you a little more stretch. You can lean in and give it a little bit of stretch, relax, hold it for 15-20 seconds or so. You can move it up a little bit more, stretch in again, okay? You can also put your arm straight out against the wall and then take a step forward. That'll help stretch things backwards, okay? Just do that a couple of times a day. You're not trying to go from here to here within a day. You got a couple of weeks to get through there, and you should just automatically progress and do quite well. So a couple of times a day with that, starting a week after your last drain is out. Let's see here. Any other questions at this point in time? We can go over, again, what your pathology results were, any anticipated chemotherapy or radiation, or hopefully none of those, or but we'll address any concerns with any of that on there. Activity-wise, you can start doing a little bit more. You can get your heart rate, your blood pressure up now. If you want to go for a little bit longer walk, you want to get on a treadmill, you want to ride a little recumbent bike or something like that, totally fine. I'm okay with that. Just don't be doing, jumping jacks. Don't be speed walking with your arms moving a whole ton. Don't be do something where you're going to be jogging and bouncing on there. But you can get get a little exercise in, work on your legs. You can work on real just light stuff on your arms if you wanted to. Again, the goal is not to strain right now or stress anything out or make a lot of motion, but a little more activity is fine. You're probably getting a little stir crazy at this point in time. So overall, to keep this short, congrats, you made it 2 weeks. You're getting way over the hump on here. If you've got an expander, we're going to start filling you up at this point in time. Don't be worried about it. It doesn't hurt at all. We'll refill any medications you need to, and we'll go from there. We'll see you.